Trade and all of that. Hello and welcome back to Ticker Talks, and together with Polaron Language Services we are looking to use language to connect communities. And whilst Polaron is the sponsor of our program, all of the views and opinions in the following segment are of course our own. And before we start, I would like to also acknowledge that this segment is being held on the traditional lands of the Wurundjeri Woiwurrung people, and I pay my respects to both to elders both past, present and future. And I am joined by Director of Polaron Language Services, Eva Hussein, in studio. How are you today?
Very well, thank you. Thank you for having me.
No way. Well, thank you for coming along and bringing your guests and your topics as you always do. So what's been happening at Polaron this week?
Look, I do have a very exciting announcement to make because at the end of September, we're holding a mental health forum focused on language services, because it's usually that gap that's not always fulfilled by mainstream organizations when they think of providing mental health support services. So we called it the other 29%, and that is because 29%, yes, you can see it on the screen, around 29% of Australians speak a language in addition to English at home. So we're trying to focus on people that may not be considered mainstream and equipping organizations with information about how to do it better. Because I think if you think about it, all the slogans, we in it together and all of that, it does not necessarily apply when you keep 1/3 of the population out of the conversation. So we're going to also be showcasing an impact report which we developed out of the previous forum, which was on co-designing resources with our communities. So we do believe that you don't need to go out there and engage people before you can talk to them or at them, like some organizations do. So this is a two-way street conversation about mental health in the context of language services and how to translate, how to provide interpreting services to those that need it, that other 29%.
Awesome. You guys are always up to some great stuff. I think that's fantastic to hear. But let's touch in with miscommunication of the week. What have you found? What have you seen out there?
Mike, this is a bit of a interesting topic, and it's to do with consent. So if you think about it, a typical medical setting is full of risk in that, there are doctors, there are systems, there's tools, there's, this huge machine that works around you as a patient if you end up being in a hospital. And what happens if you do not understand everything that's being told to you, or if you haven't been able to give consent, things can go really wrong, and sometimes they do. So these things happen rarely, but when they do, as in the case that we're seeing on the screen where a mother wasn't, so the mother wasn't given access to an interpreter, and like a series of things went completely wrong with the baby ending up with very severe disability. But what I want for people to take away from today, from this chat, is that when it comes to consent, you need to be sure that people understand what they're signing, what they're going through. If there's a language barrier, there are interpreters, there are translation services, there's all kinds of systems we have in place. We just need to tap into it to just reduce that risk for someone who may not speak English, as well as you'd want them to be able to make informed consent.
That is incredibly isolating, I feel, especially for someone who's going something through as traumatic as a procedure. So that was quite... It
is confronting, and I think, even in Australia, every day there are, that 29% of people, or whatever the percentage is, going through medical procedures that may not always be across what's happening. Explaining risks, explaining consent, and achieving informed consent is really important in a medical setting, as it is in many others. But you don't want the wrong arm being cut off, or whatever.
All right, well, let's get into our discussion for today. And almost 3 million vaccination doses have been administered to Victorians, and each day we're seeing those vaccination numbers increase, thankfully. However, engaging with Victorians from diverse backgrounds during the vaccination rollout has posed its own set of challenges due to language barriers and/or cultural differences. So today we'll sit down with a vaccination engagement expert to discuss their strategy to overcoming any challenges that may arise as this health information is changing rapidly. So be aware that you can actually visit this website on the screen, www.coronavirus.vic.gov.au/vaccine, to find out the most accurate and up-to-date information. But joining us today to discuss this very important topic is Dr. Stephen Liu, a Clinical Vaccination Champion for the Victorian Department of Health COVID-19 vaccination program. And Stephen practices as a GP, and he's worked extensively across the fields of intensive care, general medicine. Mate, you've done a lot. Welcome to the program.
Thanks for having me on.
No worries. Let's dive right into this one, because this one's really important, as we've touched on and continue to touch on as this vaccination rollout continues. What have been some of the challenges with engaging multicultural communities during the vaccination rollout so far?
Yeah, look, good question. I think, look, a lot of the human challenges, right, and this is not specific to engaging with the multicultural communities, but all communities. So these human challenges are really applicable to everybody. It's uncertain times. People are emotionally coiled, and people have very understandable fears and concerns. So those things all impact, everybody. But when it comes to multicultural communities, they could form sort of additional barriers. With multicultural communities, we do have challenges such as sort of lower levels of English skills, varied levels of health literacy. For some communities, there may be a lack of confidence in government or authorities due to previous traumas or past life experiences, and also being unfamiliar with the healthcare system. Not just recent arrivals, but also a lot of community members from CALD backgrounds, culturally and linguistically diverse backgrounds, may have been here for a long time and still not very familiar with the healthcare system, because it can be complicated.
Oh yes.
And then on top, So and then on top of that, and again, it's applicable to the whole community. They can be misleading information and different sort of unhelpful rumors and disinformation on social media platforms.
Yeah. Now, is it safe to say that as the pandemic rolled out and the government started reacting to it with lockdown laws and things like that, that was a very difficult time for all of us and remains the case. But why is vaccination seemingly so scary, so confusing? It's the jab that is causing so much trouble at the moment. Whereas, it's just interesting to me, because obviously lockdowns and communicating that with multicultural communities was in the early days, same with mask wearing. But this jab is seemingly so confusing.
Yeah, that's right. So I think there's multiple reasons for what we're seeing, and really it's a over-representation of say side effects or fears from the vaccine, and with something as complicated as dealing with a global pandemic, and trying to keep everyone safe and trying to keep the health system functioning and trying to engage with different communities and get good information out there, it's challenging to it's challenging for individuals, right? Because, like I said, it's uncertain times and people want some sort of control, and the easiest thing that they see is the stuff that's sort of on their phones. And a lot of the things that we see that's sort of a bit of misinformation usually has a kernel of truth to it. But what we hope to achieve is to guide people with a more holistic, well-rounded view of things, because there's really quite a lot of different axes to this problem, right? So, one is the actual problem, like COVID, the dangers of COVID, the dangers of the new variants, how it impacts individuals, how it's making people sick, young people sick, how it's making pregnant women sick. That's a big aspect. And then the second aspect is really the non-vaccine, the non-vaccine measures that we've taken to keep everyone safe, including the lockdown, which is undeniably effective, but very hard. It gives everyone a very difficult time. And then there's obviously the vaccines, and the vaccines are unbelievably effective. It's incredible. We know this from not just the scientific studies, and not just the clinical trials, but also real world evidence that it works. But the reason, like I said, there's a lot of reasons. One of the reasons is because we've dealt with the pandemic very well early on, the fears of COVID were probably underrepresented. And people sort of gravitated towards, looking into the fears, and the potential risks of the vaccine, which when you put it into context, when you look at it more holistically, is really minuscule. And they're the things that we're trying to work on. And it's not just with multicultural or CALD communities. It's with my patients just every day. Every part of the community can be subject to partial information.
Yeah.
And then that sort of generates a lot of fear and concern. And I always tell people, there's no dumb questions, right? Everyone has understandable fears and concerns, but it is an information access issue, and with better information and with better engagement, I think we can guide people to make good decisions, make good, holistic, well-considered decisions.
Well, just on that, what initiatives do you think have had the most positive outcome with engaging multicultural communities there? Just some of the positive stuff that we've seen actually work.
Yeah, so with my work through the Department of Health in the Vaccine Champion program, so I present webinars, info sessions in both English and in Mandarin. So Mandarin particularly for Mandarin-speaking Australians, and they have been really effective because human connection is really powerful, and it's important to note that the broad majority of people who are fearful of vaccines or a little bit vaccine hesitant, they're not bona fide anti-vaxxers, right? They do have genuine concerns and fears based on the information that they've received. And if, good scientific, reputable information from trusted sources are underrepresented, then they're going to have to, then they get a misrepresented sort of view of things. And with the engagement, so we through this program engage with the whole community in all different walks of life, really, from different cultural groups to different sort of community councils to local government areas to different sectors. And we found that that's a very good way to speak to people and very good way to get the message out there. So that's one of the strategies. And the other is appreciating the information channels that people get their information from. So like I said earlier, different CALD communities, for instance, the Mandarin-speaking community, often get their information from their own social media platforms, right? So fewer Chinese-speaking Australians are probably looking at Facebook and Twitter and Instagram, but more so through in-language social media platforms of their own. So it's important to be smart and think more strategically and say how do we engage through the channels that people most commonly use, and make sure we get the good quality content and information out there through those channels.
Dr. Stephen, mate, thank you so much for your time and unpacking that awesome topic for us today, and thanks for coming on Ticker Talks.
Nice, it's my pleasure.
Perfect there. Now, Eva, would you like to give us a bit of a summary in relation to what we spoke about on today's episode?
Thank you, Mike, and what a great presentation from Dr. Stephen Liu. In summary, I would just say that when people think of whoever you are out there, considering translations or language services, do not think about why the community is not engaging with you, but what you are not doing to engage the community. So it's kind of flipping that on its head and thinking about different approaches, different methods, different forms of engagement. So it shouldn't ever be a one-way street. It should be a dialogue, a conversation. And if there's something that doesn't work for you in terms of engagement, you might need to reflect on your activities or lack of thereof before you start talking about communities not engaging.
Yeah, especially when it comes to health and society and what we're looking at the moment. I think that's a really great message.
Right.
Yeah. Thank you so much once again for your time and your wonderful guests, as always.
Thanks for having us.
Easy done. And guys, if you've got any more questions about how to reach your multicultural audiences, get in touch with the team over at Polaron. The contact details are on the screen. I'm Mike Loder, and thank you so much for joining us on today's episode.